My name is Liane Jollon, and I'm the Director of San Juan Basin Public Health. We serve La Plata and Archuleta counties, and we have been responding for the last 9 months to the COVID-19 global pandemic in our local communities. We know that people are tired of COVID-19, and we realize that there is fatigue around this global pandemic. Unfortunately, we cannot let this fatigue interfere with our abilities to control the disease. Colorado is experiencing a dramatic increase in cases right now this week that is beyond any increase in cases we have experienced, including in March and April of this year. So it is really important that we understand what is happening across the state and understand that we still have the power in Southwest Colorado to change our trajectory and not follow suit with the rest of the state of Colorado. So currently, the estimates for Colorado are that 1 in 100 residents across the state is infectious. I'm going to say that again because it's a startling number. Just a few weeks ago, we were returning 200 cases a day. We're now returning 3,000 cases a day. And the modeling and estimates believe that 1 in 100 of us is currently infectious, therefore contagious with COVID-19. We have got to, as a community, come together and address the dramatic rise in cases in our corner of the state so that we can keep kids in school, keep as much of our economy open as possible, and keep people getting paychecks and meeting their needs. So we are going to ask you to make some adjustments today. We acknowledge that this is hard and we acknowledge that we're all tired of it, but these are simple requests that we are asking. Please keep your interactions with other people as limited as you can. If you are choosing social interactions, do them outside, keep them 6 feet apart, maintain mask wearing anytime that you cannot keep your 6 feet distance, and really think carefully about whether or not you need to do this right now. If you can work from home, please work from home. If you have any symptoms and you're not sure that they're COVID symptoms, please do not go to work, do not go to social engagements, and get yourself tested. If we take these steps as a community, we can get through this tough period that Colorado is looking at. But what we've heard from the White House Coronavirus Task Force just this week is that the most difficult, darkest days of COVID are ahead of us, not behind us in the state of Colorado. So we are asking you to join us here at San Juan Basin Public Health in creating a community response to this that will keep as many of us as healthy and safe as possible. Thank you. So now I'd like to answer some of the questions that we've received this week, and please submit questions every week so that we can provide the community with answers. So one of the questions that we've gotten this week is, what are the metrics for closing schools? So in the state of Colorado, we do not have defined metrics for closing schools. We do honor that in Colorado, there's local control of schools, and these are decisions that school boards, along with school superintendents, can make for the community, and they do that in conjunction with local public health. So we as San Juan Basin Public Health have been meeting almost daily with schools across our 2 counties, and we are in very frequent discussion with our local colleges, both our 4-year college and our community college, around how to contain disease as it is growing in the community. So the first thing to know is that all of our schools have put in really good precautions and follow statewide K through 12 guidance or follow statewide higher ed guidance around how to ensure that they are operating as safely as possible with what we know about COVID-19 at this time. So due to these precautions, we do not see high levels of transmission in any of our school settings. In fact, as we are seeing cases increase, the increase is happening in the community, not in the school settings. The problem that we're going to have is that as we increase burden of disease around the community, it gets harder and harder for any school setting to operate, because we will start to see high levels of absenteeism as individuals either get sick with COVID or are exposed to COVID. The next question is about testing return times. When we see large increases in cases and large increases in hospitalizations, there continues to be increased demand on testing. So for example, last week when Colorado was experiencing about 2,000 positive cases a day, they were receiving 23,000 samples to the state lab that can only handle 8,000 samples a day. So with that, there has been work done to send out samples from the state lab to other labs around the country. And San Juan Basin Public Health was very fortunate to arrange to have our samples sent to a lab in California and bypass the state lab. So currently, we expect that our results should turn around in 3 to 5 days, when we are seeing much longer turnaround times for all of the other free community testing that is going to the state lab. The next question that we have is around the positivity rate of our testing. So in this metric, we're in very good shape here in Southwest Colorado. We have not seen in La Plata or Archuleta County our test positivity rate go over 5% since we've brought testing to these communities. So we have good evidence that we are picking up a lot of our cases here in La Plata and Archuleta County. What we're starting to see around the state is test positivity rates going over 15%, and even in some communities going over 20%. The importance of that metric is it lets you know if you have enough testing available in your community to capture enough of your positive cases to then effectively investigate and control the positive cases that you have. So again, we have not come close to going over 5% for our test positivity rate here in La Plata or Archuleta counties, but the state of Colorado is seeing significant increases in test positivity rates. We also have a question about, are we testing more? So we have been working, and by we, I mean the public health community across the state of Colorado and across the country, has been working to bring more testing to every community in the country since the beginning of this pandemic. So yes, we are increasing our testing, and we have seen testing again increase everywhere in Colorado. When your positivity rate also goes up with your testing rate, it indicates that the amount of infection is also increasing, and that it is not simply that we're testing more, that's why our numbers are going up. Locally, our test positivity rates have been pretty consistent. So as we increase testing, the percentage that comes back positive remains fairly consistent or has even seen a slight uptick. So this is not an indicator that our uptick in cases is merely related to an uptick in testing.